introduce him. Hello, everyone. Welcome to the 2017 to 18 Cancer Center Series. This is our inaugural talk of the year, and it's my pleasure to welcome Daohong Zhou from University of Arkansas, the medical sciences there. Daohong's an old friend and colleague, and he's just doing fantastic work on radiation and now venturing into aging. So Daohong got his MD degree in China and Yunnan University, and then came to the U.S. and he did postdocs at Johns Hopkins and at the University of Pittsburgh. He then moved on to the University of Kentucky as a junior faculty member, and then was subsequently recruited by Medical University of South Carolina, where he was a more senior faculty member. And then about 7 or 8 years ago, he got recruited to University of Arkansas, where he's a full professor there, and he's also the Winship Rockefeller Endowed Chair for Leukemia and Lymphoma. And in addition, last year he got a prestigious award, and I'm going to put on my glasses because it's small print, the Arkansas Biosciences Institute Established Investigator Award. So Daohong has really done something that I think is that we've all sort of thought of as a holy grail, which is to come up with basically a type of treatment that can rejuvenate, where you can actually treat, an old animal with a compound and get youthful-like stem cell activity. And he's done this post-irradiation, but he's done it with age, and he's going to tell you more about this today. And if you don't believe how well this is working, I'd like to mention that Daohong was born in 1910. So without further ado, Daohong. So are you going to use this, or do you want to use it? Okay. Yeah. Just if you want to be able to wander, you'll need that.
Yeah, you have to use this mouse too. Thank you, James, for your nice introduction. And it's a great pleasure for me to come to here. And this is first beautiful new campus I've seen in U.S. since I came to U.S. Probably 27, 28 years ago. And particularly over years, and James' discovery and theory has influenced my research. And his idea that stem cells can competing with each other with mutant cells, that may be a very important aspect for suppressed tumor genesis, is really inspired me to study senescence, and also how senescent cell has any impact on this process. So today I'm going to give you some ideas and just some update the research you have been doing, try to find small molecule that can kill senescent cells. So as we know that, so first I need to disclose some conflict interest. I have been working with Unity and to develop synthetic agent for age disease and cancer. So as we know that senescent was first discovered in 1961 by Havlik. Basically he cultured fibroblast cells in vitro from normal human being. And those cells eventually stopped to grow after extensive replication. And he termed this phenomenon as a replicate senescence. And later on, people also call this Havlik limit. However, the mechanism why cells stopped to grow after extensive replication was not known until in 1980s. The study by Dr. Blackburn and also Grider and also Sustak, and they showed that actually most cells do not express telomerase. Each cell cycle replication result in telomere shortening that eventually trigger DNA damage response that cause replicate senescent cells. So at the same time, around in the 1990s, now several labs show that cell can undergo senescence not only because extensive replication due to telomere shortening, but also exposure to variety of stress, including oxygen stress, DNA damage, and also oncogenic stress, indicating that senescence can occur not due to telomere shortening and replicate senescence, but also can be influenced by environment, such as DNA damage. So even though cell can undergo senescence through either stress-induced senescence and through the telomere shortening, but they use same pathway for the induction. So the two pathways has been shown very important for senescence induction, including DNA damage pathway, which trigger activation ATM, PP3, and therefore induce P21. At the same time, all those stress and also telomere shortening and also can activate P38. And P38 activation also can upregulate P16 expression, which we don't know exactly the mechanism. And increased expression P21, P16 can inhibit cyclin-dependent kinase and eventually result in permanent cell cycle arrest. But more importantly, the cell, after they undergo senescence, they have some unique phenotypes. And not only they show that morphologically are different from normal cells, but more importantly, there are several biomarkers, hallmarkers has been used to identify senescent cell, including increased expression of senescent Soch beta gale, increased expression P16, P21, which mediates senescent induction. And also, more importantly, they gain new function, and they secrete a lot of inflammatory mediators, chemokine, cytokine, and also proteases that can regulate X-ray matrix, which collectively called senescent Soch secrete phenotypes. But strangely, even though cells become senescent, and they are still metabolically active, they are not dying. In fact, they are more resistant to apoptosis induction compared to normal cells. If you expose senescent cells to radiation and oxygen stress like H2O2 and also chemotherapy, they are extremely resistant to those agents, and indicating they also gain a resistance to apoptosis induction and become very resistant to cell death induction. So initially, people believe that senescent induction is very important for to suppress tumorigenesis, because when cells undergo oncogenic stress, DNA damage, become genetically stable, then they undergo senescence, so therefore the cell will not propagate. But more importantly, through SSP, they can induce immune response to help clear the cells. So therefore, you can permanently remove senescent cells, prevent them further undergo accumulate more mutation and for transformation. So it functions as a very important tumor suppressor mechanism. But recently, people also found that induction senescence also play some physiological role, including embryogenesis, but also involving tissue repair regeneration when that's wound. But the problem is that acute induction senescent cells usually can be rapidly cleared by immune system, so they can be beneficial by suppress tumor genesis and also promote wound healing. But if the stress persists, and in combination with immune dysfunction, whether it results from aging or from exposure to genotoxic stress, then the immune system becomes compromised, and they're no longer able to rapidly clear senescent cells. And those cells can start to accumulate. And when they accumulate, they produce tons of free radicals and also inflammatory mediators and other factors we call SSP. In those conditions, actually senescence become very detrimental. They probably involve in aging-related disease, and also promote tumorigenesis, but more importantly, may relate to tumor resistance to chemotherapy radiation and tumor relapse and metastasis, and also involve in variety of normal tissue side effects associated with chemotherapy radiation. So therefore, people have been hypothesized that if you inhibit induction senescent cell, can be detrimental because it will promote tumorigenesis. But in contrast, if you can promote senescent clearance, which can be beneficial. So even though the hypothesis has been proposed for many years, the first evidence to show that senescence definitely is detrimental, particularly related to aging, was demonstrated by a study done by Derek Baker in Mayo Clinical. They published first paper in 2011. So what they did is they generated transgenic mice which express transgene called INC-ATAC that encode protein, including FK binding protein fused with caspase 8 under P16 promoter control. Because majority of senescent cells show increased expression in P16, so therefore, theoretically, majority of senescent cells also express this transgene. So this transgene expressed on cell membrane, if you treat the cells of mice with a compound called AP20187, which causes dimerization FK binding protein and resulting activation of caspase 8. Therefore, you can genetically clear senescent cells. So initially, they made the transgenic mice in a called BARB-R1 hypomorphic mutated genetic background, and this BARB-R1 is a protein involving mitotic checkpoint control. So mutation in this gene results in chromosome abnormalities and also result in premature aging, shortened lifespan, and the mice develop the age-related phenotype, including sarcopenia, not kyphosis, and cataract at much earlier age. So what happens is that if you if they treat the mice with AP compound, they can clear senescent cells, and they show they can dramatically delay the onset of those age phenotype. However, the mice still die early, so there's no extension lifespan, but definitely show extension health span, indicating in this premature aging mouse model, senescence play a very important role in age-associated some pathologies. But there's still a question whether normal age, whether the senescent cell accumulating in normal aging condition, whether also play a role in aging and age-related disease, and particularly whether clear senescence can really beneficial by extending lifespan. So therefore, the regenerated mice in wild-type background, either in 57 or mixed genetic background between 129 and 57. So the weighted mice at 1 year old start to clear senescent cell by treating the mice with AP compound every other 2 weeks, up to 2 years and even longer. So what you can see here, and this is just 2 examples, the mice without AP compound treatment, so therefore the senescence still accumulate without clearance. And this is a mice with senescent clearance at 2 years old. So you can see there's huge difference. The mice with senescent clearance look much normal. But more importantly, if you look at lifespan, and they show that doesn't matter whether the mice is male, female, and either on 57 background or on a mixed genetic background, by clear senescence, they can extend lifespan up to 25 to 30%. So this is huge health benefit effect. But more importantly, also show that not only the mice live longer, but they are also healthier. They show much delayed cancer onset and also delayed age-related pathologies. So this indicates indeed senescence play a very important role in aging and age-related disease, and including cancer. So by clear senescent cells, you can not only extend health span, but also lifespan as well. So another question is that whether senescence play a role in cancer, and particularly related to cancer treatment. So Julie Capizzi's group and Marco in a postdoc working her lab and collaborating with us and also with Julie, with Lars Chaplis, did a study with another mouse model called P63MR mouse model. So in this mouse model, Julie put a transgene called luciferase, basically a 3MR transgene, which includes luciferase, RFP, and also herpes virus cervicalis, and the P-signaling promoter control. So therefore, all the senescent cells express those transgenes, and you can use luciferase to monitor senescent accumulation by chemiluminescence imaging. And you also can genetically clear senescent cells by treating the cells of mice with compound gonzaclivir, which can be converted by herpes virus cervicalis and become a toxin, and therefore they kill senescent cells. So in this study, they show that if you treat mice with any chemotherapy agent that commonly used in clinical, including Dr. Robinson, cisplatin, and also Taxol, and you can see there's dramatic increase in senescent accumulation after treatment. And by giving the drug, by giving gonzaclivir, you can clear senescent cells. The induction senescent cells associated with increased expression in several inflammatory mediators, including IL-6 and also the chemokines as well. By treating the mice with GCV, you can pretty much downregulate the expression of those SARS factors. But more importantly, when you treat the mice with Dr. Robinson, it can cause several side effects, including suppression of bone marrow function and heart dysfunction, including you can measure heart function by looking at ejection fraction. And also the mice develop fatigues, and they are less active, so show a dramatic reduction in running. But if you treat the mice with GCV after Dr. Robinson treatment, you can dramatically improve bone marrow cell function and also reduce heart toxicity and also fatigue induced by chemotherapy agent like Dr. Robinson, indicating that chemotherapy agent can induce side effects primarily by inducing senescent cells, and which promote production of such factor by clear senescent cell, you can dramatically reduce chemotherapy associated with chemotherapy-induced side effect. But more importantly, she also transplanted breast cancer cell into P1603R mice. And when they treated mice with Dr. Robinson, even though the treatment can temporarily suppress tumor cell growth, but has no effect on the cure. And also, the tumor cell eventually migrate into lung and become metastatic in lung. And interestingly, if you treat the mice after Dr. Robinson with GCV to clear senescent cell, the senescence is only in the host, but not in the tumor, because only P1603R mice and only those cells, the cells from senescent cell from those mice host become senescent, can be cleared by GCV. So by clear host senescent cell with GCV, they can dramatically reduce lung metastasis and also improve the survival rate of the mice. So indicating senescence also contribute to tumor resistance to chemotherapy and metastasis. By clear senescent cells, you can also improve tumor response. So another thing is that most people hypothesize senescent cell maybe play a role in aging, age-related disease, and including cancer by compromised tissue stem cell function. And that probably related to James' hypothesis, because if normal stem cells become dysfunctional, and they are less capable and less fit to suppress mutant cell expansion. And there are several reasons that senescent cell can compromise tissue stem cell function, including if stem cell itself becomes senescent, definitely you have a dysfunction stem cell population. But in addition, senescent cell also occur in the stroma cell population, and that also can disrupt stem cell leach, either directly and indirectly through increased production free radical and also SSP that induce oxidative stress and inflammation that also can either damage the leach and also can induce stem cell senescence, and therefore result in impaired tissue homeostasis and repair regeneration that can contribute to aging and age-related disease and including cancer. So therefore, we were interested to see whether clear senescent cells actually can maintain prevent stem cell aging. So we use stem cell as a model in which we use a Julius mouse model, P1603R mice. So when the mice reach to 1 year old, we separate them into two groups. One group receive Wilk treatment, another group receive GCV treatment that can clear senescent cells. So after 1 year treatment, at 24 months old, we isolate their bone marrow stem cells and did transplantation to look at whether stem cell function will be maintained if we can clear senescent cells, because normally by 2 years old, the bone marrow HSC become dysfunctional. And as you can see here, after transplantation, if the mice, in aged mice receive Wilk treatment, they show dramatic reduction in long-term engraftment compared to young mice. But more importantly, they also show we call myeloscuring, which means the cells from aged mice treated with Wilco show less capable to differentiate to T cells, B cells, but increased differentiation to myeloid cells. In contrast, if the mice were treated with GCV over the year time, they show their engraftment rate almost as young mice. There's no reduction. But more importantly, the myeloscuring was completely prevented, indicating indeed by clear senescent cells, you can prevent stem cell undergo aging. But more importantly, we did a serial dilution assay to quantitate functional normal stem cells in aged mice. And here again, we have three group mice, young and aged with Wilco and GCV treatment. Then after 1 year treatment at 2 years old, when the mice reach 2 years old, we isolate long-term HSC and transplant different numbers of HSC into recipient and look at the percentage of engraftment. In this way, you can calculate the frequency of normal stem cell in the long-term HSC population isolated by flow cytometry. So what you can see here in young mice, 1 out of 9 long-term HSC you isolate by flow cytometry, and they show engraftment indicating they are true long-term stem cells. with aging, the number of stem cell function reduced dramatically and almost about 9-fold reduction. But by clear senescence with GCV, the aging mice have similar number, almost exactly same number long-term HC as young mice, indicating indeed by clear senescent cells, it can prevent decline in normal HSC. So collectively, those studies show that indeed senescent cell may be an emerging target for aging and age-related disease and also cancer. So if we can find a small molecule can kill senescent cells, potentially those drugs can be used as a use fountain and also for anti-aging for cancer purpose. So I think the study published by Baker in 2011 stimulated enough interest to identify small molecule that can kill senescent cells. It's like a gold rush, and our lab and many labs tried. So at the beginning, everyone used high-school screening, RI, but somehow nothing came out from the study. And so about 4 or 5 years ago, and we end up have no other choices, so we decided to go back to a very basic strategy. So basically, we use WR38 cells and induce them become senescent either by exposure them to radiation and after extensive replication in vitro and transfect with RAS oncogene. And after this treatment, they become senescent. Then we collect senescent cells along with normal cells, culture them in 24-well plates, and with different concentrations of compound we believe may be important for survival, for senescent induction, and also maintenance, to see if we can identify a compound can selectively kill senescent cells. So after 3-day treatment, we collect cells, count cell numbers. So this is a very tedious assay. So only this assay turns out productive. So after screening probably several hundred compounds, we identified 2 compounds that can selectively kill senescent cells. One is AB263, which is a BCL2 B6 inhibitor. The second one is called pipernogamine. And I will give you some illustration why we think pipernogamine also can kill senescent cells. So first, you can see, compared to normal cells, that matter whether senescence induced by radiation, or whether extensive replication and RAS oncogene transfection, all of them become more sensitive to AB263 treatment compared to non-senescent cells. But more importantly, it appears that AB263 is a broad-spectrum senescent agent, and you can use fat blood cells from human, and after exposure to radiation, and either WR38 cells and MR90 fat blood cell, and when they become senescent, they become more sensitive to AB263 compared to non-senescent cells. And similar finding was found that in renal epithelial cells and also HUVEC endothelial cells. So when those cells become senescent, they also show higher sensitivity to AB263 compared to non-senescent cells. Similar finding was also observed in mouse and very fat blood cells as well. So indicating that the effect AB263 is not dependent on cell type and also not dependent on species. So the mechanism for AB263 to induce senescent cell death is primarily by induced apoptosis. As I mentioned, because AB263 is a BCL2 B6 inhibitor, which primarily inhibits endogenous pathway for apoptosis induction. So as you can see here, the senescent treated with AB263 should increase in apoptosis by addition 5 and PI staining. If you pretreat the cells with QVD, which is caspase inhibitor, you can pretty much block the effect that induced by AB263. And furthermore, if you count viable cell number, you can also see that AB263 treatment reduces viable cells, which completely blocked by QVD. Then the question, why senescence are more sensitive to AB263? I think if you think about senescence are almost like a live on the edge. They sustain DNA damage, and the damage comes out repaired, and they constantly have DNA damage response. In addition, they also produce more free radicals and also undergo constant oxidative stress. So therefore, we show that they also increase expression backs because of DNA damage response. So to maintain their viability, they also upregulate expression B6 cell to protect them from undergoing apoptosis. So as long as you inhibit B6 cell, maybe other family or BCL2 family, and those cells will rapidly undergo apoptosis. In contrast, in normal cells, there's no DNA damage response, and there's no oxidative stress. So therefore, they are less rely on BCL2 family for protection. So even though in vitro we show that AB263 can selectively kill senescent cells, it remains to be determined whether they can be also effective in vivo. So to test that, we again use PCN3 mouse as model, and we use total radiation to accelerate induction senescent cells. So as you can see here, we expose PCN3 mice to sublethal radiation 6-ray, which will not kill mice, and they can recover from acute radiation syndrome, but eventually will recover from the injury. However, with time, there's more rapid senescent accumulation after radiation, particularly at 4 months, 6 months, you will start to see a dramatic increase in senescent accumulation. And this can be determined by both luciferase imaging, and also you can take the mice, you can sector mice and take the tissues and measure PCN expression and such factor. For example, in the lung, you can see the dramatic increase in PCN expression coupled with the chemiluminescent imaging as well. So use this mouse model, we irradiate mice with 6-ray radiation. 4 months after radiation, we treat mice with Velcro, GCV, and also AB263. And GCV was used as control to genetically clear senescent cells and to determine whether ABT can also effectively remove clear senescent cell in the mice. So as you can see, after radiation, the mice treated with Velcro show dramatic increase in senescent accumulation. And however, when the mice was treated with GCV ABT, they can dramatically reduce senescent accumulation, indicating indeed AB263 is equivalent as GCV to clear senescence in the total body radiated mice. To further confirm that, we also collect lung tissue from these mice and did a PCR to look at PCN expression and also such factors, including L1 alpha, TNF alpha, CCF5, CXCS10. As you can see here, the lung tissue from irradiated mice treated with Velcro show increased P16 and L1 alpha and TNF alpha and all those such factors. When the mice were treated with GCV ABT, and the expression P16 and production such factor was dramatically reduced, indicating that indeed AB263 is equivalent as GCV to clear senescent cell in vivo in total body radiated mice. And furthermore, we were able to extend the study to normal aged mice. So when the mice reach about 2 years old, and they also show increase in senescent accumulation. And if we start treating the mice with ABT at 2 years old, then for 2 cycles treatment, as we did for ABT for total radiation mice, we're also able to reduce senescent accumulation in normal aged mice, and also reduce non-PCN expression and such factor production as well, indicating that ABT not only can clear premature senescent cell induced by radiation, but also can clear normally senescent cell generated in normally aged mice as well. So with that information, we wonder whether senescent cell clearance can help to rejuvenate aged HSC. So because we know that senescence can also occur in human system, particularly in stem cell population. And either with radiation, with aging, the stem cell can undergo senescence. And they show decrease in self-renewal. And also, as I mentioned before, they also show myeloskewering. And particularly, they may accumulate more DNA mutations. And all those changes eventually may cause aging and some of those hematological disease, including anemia, immunosenescence, and MDS leukemia. So the question whether we can kill senescent cells and we can remove the senescent HSC and allow normal stem cell to repopulate, and therefore we can rejuvenate the HSC and to prevent some of those age-related changes in the human system and to prevent MDS and leukemia. So to test that hypothesis, first we use a premature aging model that induced by radiation. Again, we expose mice to 6-degree radiation by 8 weeks, and all the stem cell, all the blood cell bone marrow cells and including stem cell population regenerate and become relatively normal, except the function of stem cell remain suppressed. So if you look at stem cells that from redeemed mice, they show increased expression P16, ARF, and P21, and also increase in beta-gal staining, indicating some of those cells undergo senescence. And however, the senescence induced by radiation is not due to extensive replication. It's primarily due to premature aging, premature senescence. Because if you measure telomere length in both stem cell population and in their progeny, such as T cell and myeloid cells, there's no difference in telomere length shortening. So indicating the stem cell undergo senescence is primarily due to premature stress-induced senescence, it's not due to extensive replication. So when you isolate stem cells and perform function assay, we call copperstone area forming cell assay. It's a clonogenic assay. You can see compared to unirradiated mice, mice with radiation show dramatic reduction in clonogenic function, even though at that time, the number of stem cells are relatively normal as non-irradiated mice. And furthermore, if you isolate cells, bone marrow cells from the irradiated mice, transplant them into these irradiated mice, you can see here, compared to the bone marrow cells from control mice, the mice receive total radiation show dramatic reduction in long-term donor cell engraftment. And furthermore, the control mice stem cells show myeloid differentiation to T cell, B cells, myeloid cells in a balanced manner. But the cells from total radiation mice show myeloskewing, which results in dramatic reduction in T cell, B cell differentiation, but increase in myeloid differentiation. Those phenotypes very similar as we see in aged mice. So use this mouse model, and we have mice irradiated, and 8 weeks after, when they relatively bone marrow function restore to normal level, except stem cells still show senescence, and we start treat them with either Wilco and ABT. And after 2 cycle treatment, we can collect bone marrow cells to measure stem cell senescence and also their function. As you can see here, even after 17 weeks after radiation, there's still dramatic increase in stem cell senescence based on beta-gal staining and also by PCR. Look at P16 expression. And this correlates with dramatic reduction in stem cell clonogenic function measured by copperstone area forming cell assay. However, the mice treated with ABT after total radiation, and you can see here the senescent stem cell completely eliminate, and their function also dramatically improved. And furthermore, if you transplant cells from those mice into these irradiated recipient, you can see again the mice with Wilk treatment after radiation, they still show dramatic reduction in long-term donor cell engraftment, also myeloskewing, indicating that there's decreased T and B cell differentiation and increase in myeloid cell differentiation. However, the mice treated with ABT, we can dramatically improve their long-term engraftment, but at the same time, correct myeloskewing. So similar result was also found in aged mice. So again, in aged mice at 2 years old, we start treat the mice with either Wilco and ABT263. And again, we give them 2 cycle treatment and collect their bone marrow and look at stem cell function by copperstone area forming cell assay. You can see here, with aging, the stem cell function dramatically reduced. But by treating the mice with 2 cycles ABT263, we can dramatically improve their clonogenic function. And furthermore, if we isolate stem cell and perform transplantation, you can see here, the stem cell from aged mice with Wilco treatment also show dramatic reduction in long-term engraftment and also myeloskewing, and including T and B cell differentiation was reduced, myeloid cell differentiation was increased, and those changes was completely reversed, partially attenuated by treating the mice with ABT. So indicating that indeed, by getting rid of senescent cells, not only we can prevent stem cell aging, but also can rejuvenate stem cells in the bone marrow. But this finding is not just limiting in the hemolytic system. And we also look at muscle stem cells in aged mice without AP treatment. And use combination markers of muscle stem cell, including CXCR4, CD29, CD45, CD11B, and SCAR1, PAX7. We can isolate muscle stem cell from aged mice without AB treatment. Quantitatively, there's no reduction in muscle stem cell in aged mice. However, if you put the stem cell in culture to myogenic colony formation assay, the mice with vehicle treatment, the aged mice with vehicle treatment show dramatic reduction in myogenic chronogenic function. In contrast, that reduction associated with increased P16 expression in muscle stem cells and also active P38 and increased combination DNA damage, indicating those cells also undergo senescence. However, if you treat mice with ABT, you can dramatically improve their chronogenic function, and that is also was associated with decrease in P16 expression, activation P38, and committing DNA damage, indicating that clear senescent cell not only can rejuvenate HSC in the hemat system, but more importantly, maybe have broader effect on other tissue stem cells, such as muscle stem cells as well. So then the question whether ABT can be used to treat some age-related disease. So following our study, there are several recent publications show that indeed ABT 263 maybe have some therapeutic value for age-related disease. So the first study was published also by Yang Van Dissen's group in Mayo Clinical. They generate mouse atherosclerosis disease. So basically, they use low-density lipoprotein receptor knockout mice and fed mice with high-fat diet that induce atherosclerosis. And use their genetic model, in ATAC mice, they show that if they can remove senescent cells genetically with AP compound, they can dramatically reduce plaque formation. Similarly, they also treat mice with ABT. They can also dramatically reduce plaque formation induced by high-fat diet in those mice. Another study we did with my collaborator, Dr. Amy Meng in China, we look at non-fibrosis induced by radiation, because non-fibrosis induced by radiation itself it's a side effect associated with radiation therapy. But more importantly, people use this as a model for IPF disease in human. So what we did is that we have mice either without radiation or with high-dose radiation on the chest, and we give them 17-grade radiation. And usually at 16 weeks, the mice develop very severe non-fibrosis. And you can see here, if that by 16 weeks, the side of the non-irradiated show very dramatic non-fibrosis and inflammation. And also from histology, you can see the change in pathology. If the mice was not treated with anything, I mean, there's basically now there's no treatment. The mice eventually, the fibrosis will still progress, eventually kill the mice. So that's what happened in the group mice and were treated with vehicle, and the disease not only developed in one side now that irradiated, but also crossed to another side, and eventually the mice die from non-fibrosis. In contrast, if we treat mice at 16 weeks with ABT, by that time, the disease will become progressive, irreversible. However, by clear senescence with ABT, we can dramatically improve the pathology and even reverse the pathology if you compare to 16 weeks mice at the time. So indicating that indeed ABT 263 may also have a therapeutic value for radiation-induced non-fibrosis, potentially may also apply to human IPF disease as well. And in addition, in a cancer model that work with Julie Capizzi, they also show that if you treat mice with breast cancer transplant and after chemotherapy with either ABT, GCV, you can also reduce non-metastasis and also improve the survival of the mice. So indicating that ABT263 also have an effect to clear senescent cells to improve cancer response to chemotherapy as well. So in summary, we can see that ABT263 indeed is a very potent broad-spectrum senolytic agent which can selectively kill senescent cells by inhibiting B cell to B cell family and also by induced apoptosis in the cell type and species-independent manner, and appears that ABT can select kill senescent cell not only in vitro but also in vivo that induced by total variation but also normal aging mice. And clear senescent cell can rejuvenate tissue stem cells, including HSC and also muscle stem cells. And potentially, ABT3 has some therapeutic value for aging and age-related disease. However, there's still a question whether you can really use ABT3 as an anti-aging treatment, because ABT was originally developed by AbbVie as an anti-cancer agent, and it has an on-target toxicity by inhibiting B-cell cell, because platelets depend on B-cell for survival. So if you inhibit B-cell cell, you also can cause platelet reduction, which is a very important dose-limiting factor in clinical. So for cancer patients, maybe people willing to take the risk compared to normal individual. So we still consider that ABT3 probably not phantom use, and we need to make a better agent that eventually we can apply to normal individual when they get older. So to get around the toxicity, and several studies has been done, try to identify new molecular target and new synthetic agent. One study published recently by Dr. Decay's group in Netherlands, in collaboration with Julie Capizzi, they identified another protein called FOXO4, which also functions as actually kills senescent cells. They show that when cells become senescent, they express increased level of FOXO4. And when FOXO4 expressed, they can interact with p53 to suppress p53 transcription activity, and therefore to promote senescent survival. And they designed a peptide to interrupt the interaction between FOXO4 and p53, which results in activation of p53 and induction of pro-apolipoprotein, and eventually can select kill senescent cells. And they show they can treat the cells with the peptide in vitro and in vivo to kill senescent cells, and also in vivo they were able to show the peptide can reduce some age-related phenotype in mice. However, because the peptide is not perfect for therapeutics because it's a big molecule, and therapeutically to translate this finding into clinical remains to be a challenge. And as I mentioned, we have found another molecule called pipenolamine. So the reason we are interested in this molecule is that, as we know, senescent cells, when they become senescent, they also produce increased level of free radical and redox species. And you can use several assays to measure free radical production, and senescent cells always show increased production of free radical. However, at the same time, even though they produce more oxygen-reacting species, but actually they are resistant to apoptosis induction by oxystress. So if you treat the cell with HT2, and the senescent show much more resistant, you have to use higher concentration of HT2 to kill senescent cell compared to normal cells. So we are trying to identify why the senescent cell become resistant to oxystress, whether there's a possibility we can identify a target, and by targeting that protein, we may be able to select kill senescent cells and prime them to oxystress damage. So in that process, we found a protein called OX1, oxidation-resistant 1, which is overexpressed when cells become senescent, both at the mRNA level and also at protein level. So X1 is a very important protein that can regulate several antioxidant enzyme expression in cells, including GPX2, homooxygenase 1, and also catenase that can block RS effect to prevent cell from further oxidative damage and cell death induction. So therefore, we wonder whether this protein is important for senescent survival. So therefore, we designed siRNA to knock down OX1. And you can see here, particularly the siRNA XL11 is very potent to inhibit the expression of OX1 both in normal cells and also in senescent cells. Interestingly, when we knock down OX1, which has minimal effect, some effect, but moderate effect on the expression of HL1 and catalase in normal cells. But in contrast, in senescent cells, they express much higher level those proteins And with knockdown OX1, we can dramatically reduce their expression. And furthermore, if you measure ROS production in normal cells by knockdown OX1 has minimal effect because overall the effect on antioxidant expression was not that pronounced. In contrast, senescent cells produce more RS with knockdown OX1, the production further increased, which can be reversed by treated cells with antioxidants such as NCT16. So when we knock down OX1 in normal cells, which has minimal effect on the survival of normal cells, however, the knockdown OX1 dramatically reduced survival of senescent cells, indicating OX1 is important for senescent cell survival. And furthermore, if you treat the cells with H2, knockdown OX1 has no effect on normal cell response to H2 treatment, but sensitize senescent cell to H2 treatment, indicating OX1 probably function as a new active field senescent cells. So as I mentioned, we found another compound called pegnogamine, which is a spice, natural compound extract from spice, non-pepper. And we show that this compound also can select kill senescent cell compared to normal cells with a therapeutic window about 2 to 3-fold. And we found that the protein OX1 can be interact with pegnogamine. So we made a pegnogamine biotin probe. And if you incubate cell lysate with the probe, you can see that pegnogamine biotin can pull down OX1 from senescent cells. And this pull down is dose dependent on the probe and also can be completely blocked by pre-treated cell lysate with pegnogamine to compete in the binding. And furthermore, even use recombinant human OX1, we show that the pegnogamine biotin can pull down recombinant human OX1 protein. Again, that can be blocked by treating the protein with pegnogamine itself. But interestingly, when we treat the cells with pegnogamine, we show that the effect of pegnogamine has minimal effect on OX1 expression in normal cells, but dramatically reduced expression of OX1 in senescent cells. And this effect is completely blocked by MG132, which inhibits proteasome. So indicating that pegnogamine can interact with OX1 and induce OX1 degradation through ubiquitin and proteasome system. And when this occurs, the expression of those proteins may be downregulated, and there's increased OS production and also increased sensitivity to reactive species, therefore leading to senescent selective killing by cell death. So this suggests that pegnogamine analog potentially can also be developed as a new genetic agent. So we are working with a chemist and try to make new analogs to improve its potency, and also hopefully we can test in vivo to see whether pegnogamine can also clear senescent cells. I think in the future, I think the big question, as GM proposed, and whether we can improve stem cell function to suppress tumorigenesis, particularly in the stem cell population that we know play a very important role. I think as we know that in MDS and leukemia research, many genes that relate to leukemia induction actually occur when people are at a young age and before treatment. And those cells are very rare. The mutations are very rare. However, with radiation, with chemotherapy, with aging, somehow the mutant cell become expanded. And as James showed that if you irradiate mice and transplant with p53 mutation, the mutant cell expanded. So the question, we don't know what caused that expansion. So one theory, we want to test whether stem cell senescence contribute to the mutant cell expansion, because when the stem cell becomes senescent, they become next fate, next competitive, and therefore no mutant cell to expand and curing mutation that eventually may cause MDS leukemia. And if this is true, the question whether we can get rid of senescent cells after they become senescent, and therefore to no normal cells expand and to improve stem cell phyllis, whether this can result in reduction in MDS leukemia, particularly in the treatment with chemotherapy radiation. So with that, I would like to acknowledge some of those investigators in my lab, including Jian Hui and Yin Yin. They did an early study to identify ABT263 as a synthetic agent and prove it functions as a synthetic agent both in vitro and in vivo. And the newer study with pipernogamine was done in collaboration with Dr. Daohong Zhou's group, and they made a probe and know us to do protein pull down, proteomic acid, and eventually identify OX1. In addition, the study was done in collaboration with Julie Capiz's group, Ned Shapley's group, and Dr. Dinson's group. And thank you for your attention. I'm glad to take questions. Yes.
Early on in your mouse models of senescent cleared mice and normal mice, you showed two pictures with the normal age and the senescent cleared
Yeah.
youthful. Did that youthful mouse also behave like a younger mouse? Was it more physically active, did it have a greater appetite, etc.?
Yes. So basically, the mice with senescent clearance show much healthier, more active phenotype. And if you look at all the tissues, and they are much, just like, I mean, when they become 2 years old, just like a 1 year old by that time. Yeah, everything looks much better. Yeah. Yeah. Yes.
Trying to understand your model with the gamma cyclone.
Mm-hmm.
So that's only going to kill cells when they make DNA.
Yes.
You must be killing them
Yeah.
before this.
So what happens? Sure. Yeah.
Senescent cells
Mm-hmm.
won't make DNA. They can't
That's
make
true.
DNA.
Yeah. So what Julie showed that somehow the gun factor will become toxin only in the mitochondria. Actually, the senescent cells still, yeah. So basically damage mitochondria DNA that causes senescent cell death, but not through DNA damage in nuclei. Mm-hmm. Yes.
Have you tested your mouse models with ABT199?
Yes. So it appears that senescent cell more rely on BCL for survival than BCL2, but however, BCL2 can have some additive effect. So when you inhibit both BCL2, BCL, you have greater effect to kill senescent cells than BCL alone. Yeah.
Thank you for the great talk.
Thank you.
I think your story beautifully showed that the ABT263 is just BCL-XL.
Yeah.
Selectively kills cells. But I couldn't help to notice that your second third drug, as you introduced the pipernogamine, the Ross deoxyglucose modulated glycolysis. And putting them together, I think majority your leading drugs are actually hitting on metabolism. So that makes me think that does senescent cells metabolize differently from non-senescent cells, which is known in that field?
Yeah, so only so we know that senescent cell use both galactic pathway and also mitochondria oxidation phosphorylation for ATP production. They are actually more active, metabolic more active, but we haven't looked into details on how they're different from normal cells. Yeah, definitely that's an interesting question area to explore. Yes, correct.
It seems obvious, but have you done the molecular genetics to show that BCL-XL is actually the key mechanistic target of ABT263?
Yes, so we did a genetic knockdown by use srRNA, and in senescent cell we showed that knockdown BCL is very important to protect senescent survival. Yeah, we confirmed that, yes. Yeah.
How durable is the response to ABT263? In other words,
Yeah.
you have a radiated environment that has
Sure.
the propensity to generate senescent cells.
Yes.
Keep them, they regenerate
Yeah.
senescent cells.
Yeah, that's very important, interesting question. So what we found that both in premature senescence induced by radiation and also in normal aging mouse model, so the senescent clearance depends on tissue. Some maybe lasts about 3 to 4 weeks, and others may be longer. So there's a tissue-specific effect. So basically, the senescent eventually will come back, but depending on different tissues, some maybe take longer time for them to accumulate, and others may be much faster. So indicating that you have to use an analytic agent per be intermittent. You cannot just treat once, and that will not solve the problem. Yeah. Yes.
So for the HSC phenotypes, do you you know if the key is the HSC senescence or is the senescence in the niche? In other words, we make chimeric animals where, like the HSC, won't be affected by the compounds.
Yeah. So I think both stroma cells and also, both stroma cells and also HSC can undergo senescence, and both maybe play a role. So only thing we know that after clear senescent cell, we should not only we get rid of senescent HSC, but also reduce SAS factors from stroma cell as well. Yeah. Yes.
What's the dominant features of the secretory? Do you have some key?
Yes, so including, yes, so like IL-6, IL-8, TNF alpha, TGF beta, and the chemokine like CCL5, CCL10, then the the proteinase as well. So there's a whole bunch of factors, and also the SSP profile maybe depend on the tissues, which cells become senescent, and that also change their profile.
Does that probably dictate the changes in T cell, B cell, and myeloid?
Differentiation. We haven't tested directly. Potentially, indeed, that's possible. Like for example, IL-1 alpha production, as Eric showed, that may also push stem cell to myeloscurine, produce more myeloid cells. And we see that senescent environment, the stroma cells produce more IL-1 alpha. Yeah.
Thanks so much.
Okay. Thank you.